So I'm really pleased now to introduce our next speaker, Philip Steiner. He and his team at the Kansas Health Institute have been working on a report on the gaps in dental insurance coverage in Kansas. Philip is an analyst at the Kansas Health Institute. In his role, he provides data analysis and covers issues related to Medicaid, insurance coverage, access to care, and market innovation in the state. Prior to joining KHI, Philip was a research analyst actually at the Centers for Medicare and Medicaid Services, where he worked to improve Medicare payment policy in the Medicare Advantage programs and the PACE programs. Philip has a master's degree in economics from the University of Missouri in Kansas City and a bachelor's degree in economics and history from Rockhurst. So he's going to give us a brief glimpse of this new report about dental insurance rates, some of the findings about the inequities in coverage in our state. And then next week, we'll be able to release the full report and we'll share that with you electronically. We're excited about that, but we're even more excited today to be able to give you a sneak peek at what this is going to look like. So Philip, take it away.
Great, thank you, Tanya. So yeah, very excited to be here today talking about unmet dental needs and dental insurance in Kansas and what we have found and what's going to be shared with you all soon through this report. So if you go to the next slide, please. So a few quick acknowledgements before I get started here. So the report was commissioned by Oral Health Kansas and funded by the Kansas Department of Health and Environment through a grant from the Health Resources and Services Administration, or HRSA. The survey that we used for the data that's presented here and in the report was funded by a collaboration of 5 regional health foundations. So the Reach Healthcare Foundation, Health Forward, the Kansas Health Foundation, the Missouri Foundation for Health, and the United Methodist Health Ministry Fund. And then lastly, RTI International was the organization that both designed and administered the survey and provided us with the data for this analysis. Next slide, please. So quickly, the project team is myself and 3 of my colleagues at KHI, Emily Burgeon, Linda Shepard, and Wen-Che Lin. Next slide, please. Oh, sorry, next slide. And quickly, if you don't know much about us, the Kansas Health Institute is a nonprofit, nonpartisan educational organization based in Topeka. We were established in 1995 through a multi-year grant from the Kansas Health Foundation. And our work, we mostly write and hold meetings and convenings around health policy issues and public health issues in the state. And to my knowledge, we've not done a great deal of work digging into dental insurance coverage, so we were really excited for this opportunity. Like I said, excited to share the results with you today. Next slide, please. So we have 3 objectives today. I'll provide a brief overview of the study and the data. I'll share with you some key findings on unmet dental needs and insurance coverage in Kansas. And I'll talk just briefly about what some of the policy and research implications from the study might be. Next slide, please. So we had 4 main research questions. We were interested in looking at how many Kansans had dental insurance, how many Kansans had unmet dental needs, how many of Kansans with and without dental insurance had a visit, and then lastly, whether or not there were any disparities in dental insurance coverage by race and ethnicity and source of coverage. Next slide, please. So briefly, the name of the survey is the Kansas and Missouri Consumer Health Access Survey, or KMHS. It was conducted over telephone, either cell phone or landline, between September 2017 and January 2018. So the data is roughly representative of kind of the current status in Kansas as of 2017. We think it's probably reflective of the kind of the last few years pre-COVID. It's comparable roughly to the health insurance data that we have, and that's been pretty stable in Kansas. So it's a good scientific survey. The sample is representative of the state and allows us to do state level estimates for different groups. The questions were all asked to Kansas residents age 19 and older, but we do also have responses for children. If there was a child in the house, kind of a random child was chosen and an adult answered on their behalf. And then throughout this presentation in our report, we'll mostly provide descriptive statistics on dental insurance coverage rates and rates of unmet dental needs. But we do also do some statistical tests, and so any of the findings that I point out here were all tested for statistical significance with 95% confidence. Next slide, please. So I'll go through now the findings in each of these areas: dental insurance coverage, unmet dental needs, dental visits and services, and racial and ethnic disparities. Next slide, please. So the first finding here is our top line finding. We find that about a little over a third of Kansans lacked access to dental insurance in 2017, and that this uninsured rate varied by age. So senior adults, those who are 65 or older, were much more likely than younger adults and children to not have dental insurance. About half of them did not have dental insurance. And then children from birth to 18 were the most likely to have dental insurance. So about 1 in 6 of them had dental insurance. Next slide, please. One possible reason for this disparity between children and adults might be Medicaid coverage. So the survey separately asked folks whether or not they were on CanCare or Medicaid, and then whether or not they had dental insurance. And so we were able to look at, for those with Medicaid and CanCare, how many of them responded saying that they had dental insurance. And you can see that about half of adults, both older adults and younger adults, with CanCare reported not having any dental insurance coverage, whereas about only 1 in 7 children with CanCare reported not having dental insurance coverage. Now there is a benefit in CanCare, so these folks all have some sort of coverage that pays for dental services. The benefit's, I think, a little more comprehensive for children, whereas for adults it's mostly just covering preventative services. So this data point may be reflecting, just people's experience, either with accessing care or getting to see their dental providers. Maybe they either don't know about the dental benefit, or because they feel like they can't use it, they just responded that they didn't have any access or they didn't have any insurance coverage. Next slide, please. So this is showing unmet dental needs. The unmet dental need was kind of a subjective question. It wasn't defined in the survey at all. So it was up to the respondent to determine what they thought a dental need was, and then respond whether or not they thought they were lacking or had an unmet dental need. And you can see that, even though many Kansans lack access to dental insurance, there are relatively fewer who are saying that they don't have any unmet dental needs. So this is just kind of an interesting point of comparison, trying to figure out like why some of these folks may not, what they understand to be an unmet dental need is possibly something that we should continue to look into in the future. Next slide, thanks. So now we're going to look at, for those with and without dental insurance, whether or not they had a visit. So this is for folks or Kansans with dental insurance. You can see that about a quarter of adults with dental insurance did not have a visit in 2017 or in the prior year. And that children were a little bit more likely, but not much more likely to have a visit if they were insured. So there's a population of folks who, for whatever reason, we didn't have great information in the survey about why they weren't getting a visit. But there's a fairly sizable population in Kansas that has dental insurance but is not using it. Next slide, please. And so, as you might expect, this slide is looking at the uninsured without a dental visit, and as you might expect, it's much higher. So for adults without dental insurance, almost 2/3 of them are not having a visit in the last year. It's a little bit, it's a little bit less for children, and it's surprisingly, I think, lower. It's also lower for older adults or senior adults. So even though they're the most likely to be uninsured, they're the least likely to not have had a visit in the last year when they are uninsured. So must be a population that's either paying out of pocket or finding some other way to get to the dentist. Next slide, please. It's the next 2 slides, and the last 2 data slides we'll look at are looking at the disparity in dental insurance coverage for children and adults aged 19 to 64. Unfortunately, we didn't have data on older adults or senior adults. So we just look here at children and working age adults, 19 to 64. And so we break it out by Kansans who identified as Hispanic ethnicity, regardless of their race. And then for each individual race among those who identified as not being Hispanic. And you can see that for Hispanic children, it's about, they're about twice more likely to not have dental insurance compared to non-Hispanic white children. And similar for non-Hispanic Black children, they're about twice more likely compared to non-Hispanic white children to not have dental insurance. I should note that the finding for non-Hispanic Black children was not statistically significant. That just means that we probably should have or would have liked to have had a better sample. So there is some evidence there that there's this disparity, but it's just something that we should look into further. Next slide, please. And so similar for adults 19 to 64, those who are identifying as Hispanic, regardless of their race, are about twice more likely to not have dental insurance as non-Hispanic white adults. Next slide, please. So quick recap here of what our key findings were and takeaways. So about a third of Kansas reported not having any dental insurance coverage. And this coverage rate varies pretty considerably by age. So, about half of seniors or those 65 or older did not have any dental coverage. And children in particular were the most likely to be covered, possibly because of their access to a better benefit through CanCare. And as I said before, older or non-elderly adults and elderly adults or older adults were about half of those on CanCare said that they did not have any access to dental insurance. We clearly, I think, identified a disparity among the Hispanic community or those who identify as Hispanic. There's about twice higher uninsured rate for those identifying as Hispanic. And then a significant number of Kansans are not utilizing their dental insurance coverage. It's about 400,000 Kansans have missed the opportunity to see a dental provider in the last year. And we don't have great information on why. It could be an issue with access or it could just be not a full understanding of the benefit or the benefits of receiving services. Next slide, please. So lastly, I'll talk about a few policy implications. These were some things that stuck out to us from the data as potential next steps. I think certainly increasing awareness of the dental benefits for children with Medicaid and CHIP, and improving the access to dental care for enrollees in the Medicaid program. Providing more information and outreach to both seniors and Kansans who are identifying as Hispanic, see if there are any barriers to coverage, anything that additional that could be provided to them, either making coverage or access or care more affordable, or helping them potentially get to see dental providers more frequently through like improved access to transportation, maybe one strategy. Just encouraging people and educating people on the benefits of an annual visit with a dental provider. And lastly, I think the thing we'd like to point out is the data that's available. The KMHS data was a great data source, but it was only 1 year. It was in 2017. And additional data sources could be developed. Claims data is great. It provides good information on the cost of care and the services that are provided. There are federal surveys that we could dig into and try to answer some of these questions around affordability and some of the underinsured population, and then possibly a Kansas-specific survey like the KMHS to assess kind of the more recent effects, especially given some of the changes we've seen around COVID. Would all be great options for improving our understanding of dental insurance and oral health care in Kansas.
Thanks, Philip. That's a lot of information in a really short period of time. I think, you clearly did point these next steps are perfect. The data shows us that we've got a lot of gaps. We've got a lot of gaps in both actual access and awareness of benefits and utilization, certainly pointing the way to a lot more study that can be done. So just deeply grateful to you for this presentation, and even more excited to share the full study next week with everybody. Christy, do we have any questions that anybody has posed?
We do. So we had a question in the chat that asked what role you think dentists will need to play in helping to improve outcomes and help to provide access to vulnerable populations.
So, sorry, which group was that? I misheard you there.
What role do you think dentists will need to play? to provide access to vulnerable populations?
I think, and I'm not by no means the expert on you know, the provider side of this, but I think, you know, clearly I think increasing the number of providers who see Medicaid patients might be a significant, make a significant improvement. We looked at the health practice shortage areas in Kansas, and for the low-income community in particular, there's, I think in Kansas, a shortage of maybe 50 or 60 dental providers who are available to see low-income patients. That was a little bit lower than Medicaid. That was, I think, under 200% of poverty. But that is one option, I think, is if you don't see Medicaid patients currently, to start seeing Medicaid patients, or you know, more free clinics or kind of like charity care that might be available. Certainly the integrated model that Teresa discussed would be a big improvement.
Yeah, the other wasn't really a question, but I just wanted to point out, Sonia had put in the chat talking about how, you know, Medicaid recipients aren't, you know, don't know their coverage. Also kind of curious, you know, people who have private insurance, if those insurance agencies have access to data, you know, kind of wanting to know how many people are having one visit per year, if any visit per year, you know, how many people are using their dental insurance, and what can we do about that? So I think that's definitely something that, you know, we can use as next steps with this report and kind of move forward with. Are you guys planning on releasing this report in like a formal report anytime soon?
So I'll turn to Tanya for that. It's their product.
I think, yeah, we're definitely going to release it next week electronically, and then I think we'll work with KHI about how we can partner on kind of a big splash of the release. So we're still working out the kinks, but next week is our plan to get it out in public. Yeah. I did want to pick up on one thing you said too, Philip, about Medicaid, encouraging more dentists to become Medicaid providers could be one of the ways to tackle this issue. And we took a look at the awards. We were able to honor this year Representative Will Carpenter for his work over the last 2 years in helping us get 2 different rate increases for Medicaid dental providers. So we were partnered with the Kansas Dental Association on that, and we're really proud to do that. And the whole goal is can we get more dental providers? Yes, you're right.
And I will say quickly on the Medicare point, with seniors, I know the private Medicare plan options, some of those do offer a dental benefit. And so I think that's one of the takeaways that we note in the report as well, but the Medicare Advantage plans might be another option for improving coverage for the senior or Medicare population.
Absolutely. I think you're spot on. Absolutely. And before we transition here, I just noticed that Janice posted in the chat too, that we definitely need to be looking at more dental professionals being involved in long-term care facilities. And just the point that you made too, Philip, about COVID-19 has exacerbated some of these disparities and made access even more challenging. So excellent point. Well, thank you, Philip. I appreciate you taking the time and putting all this together. More importantly, I appreciate the tremendous work you and your team did on this report, and can't really wait to share it with everybody. So thank you.
Great. Yeah. Thanks for having me.
Yeah.